How the Links Worker programme started.
Essentially, the way GP practices in areas of socioeconomic deprivation were funded meant that they got less money to support their community than GPs in affluent areas. And sadly, that was simply because they didn't have enough old people on their books, because people didn't live to old age in those areas. And the formula at that time meant that those practices with more old people got more money in order to offer care. So even though there was an increased demand on GP practices in socioeconomically deprived areas and an increased complexity from the people presenting cases, they got less money. So with that in mind, and considering that 70% of our health is socially determined, the Scottish Government wanted to consider what are the skills of the general practice team. And we really, through some research and smaller pilot projects that had come before us, identified that there's a bit of a mismatch, that although the majority of that primary care team are incredibly skilled and well versed in medical and biosocial models, what they lack is the time and the information around the socially determined stuff. So the idea was to find a community links worker, someone who could connect not just the practice with their community, but also the community members themselves.
Outcomes for the programme.
It works actually towards three specific personal outcomes. One of those is increasing an individual's health competence. So do they have the understanding and health literature to be able to navigate any long-term condition or diagnosis that they have, or to be able to effectively use medication that they were prescribed? The second one was around autonomy and being able to ask for what they need and speak up. So a lot of the people that the links practitioners worked with might know that there's a yoga class down the street or a cooking class in the local college, but they lack the self-confidence and ability to go along on their own because of their life circumstances at the time. The third one was around relatedness, building their relationships within the community so that they had peer support and resilience and increase their social network of support as well. So those were the specific outcomes and the purpose of the program.
Initial scepticism.
When we went into the practices initially to try and recruit practices to take part, we were met with massive scepticism because public health and Scottish Government have lots and lots of well-intended fly-by-night newfandangled projects and programmes and interventions to deal with the multiple complex issues that we're facing as a country at the moment. So to have this still going on 10 years later is an outcome of itself.
Impact on individuals.
On an individual level, there are so many stories that I could think about. A woman in Govan who had shoulder pain that was ongoing and was prescribed painkillers for her shoulder pain and was on a wait list to access physio. When they met with a links worker, the reason for that shoulder pain was apparent. They had a blow-up bed on the floor that kept deflating. Now, it's not that the GP wasn't asking the right questions at all. They were doing their job within their specialist area. And the reality is they don't have time to have more detailed conversations and unpick people's stories. But the links workers do. And so by identifying that actually that's the issue that's causing the shoulder, they were able to get in touch with the charity, get a free bed, and then that woman's shoulder got better. The knock-on was then she could do her hair, which I completely took for granted because she'd become socially isolated because her shoulder meant that she couldn't do her hair and she didn't feel able to go out and socialise. So she went back to the dancing, social circle improved. It's just so simple, but makes such a difference on an individual level.
Funding crisis.
We are, particularly Glasgow as a city, is facing incredible pressure on its public finances and with a public health need. So not long after I was leaving, we were talking about the ongoing funding and investment in primary care and the importance of links workers being part of that primary care team. And there was a discussion at that point about whether the money should go through health and social care partnerships or whether it should be for third sector organisations to, either through competitive tender or other means, be able to do themselves. And the advice at that time from everybody involved in the programme was not to go through the health and social care partnership. And that's not because they shouldn't be trusted. It was recognising that they have so much to juggle and competing priorities that the risk is introducing a new cost to them, even with the money, was that when things need to be cut, it's likely to be something that's lesser known, that it seems a bit more malleable because it's seen as an additional add-on. Whereas if you were to remove a practice nurse or somebody else who's a key part of that primary care team, there would be uproar. So it's good to see the strong reaction to the risk of reducing the links workers, their hours or their numbers across Scotland. It's understandable that there's pressure, but this is absolutely the wrong place to take the money from. It's a cost saving in the long term, and we need long-term thinking in Scottish government politics.
Providing a simple solution.
This project can't go. It absolutely cannot go. It's simple, and maybe if it was more complicated it would be at less risk. But the links worker role, although there's a complicated theory of change behind it, it involved qualitative outcomes, quantitative measures, it's been well researched and proven to work. But at a patient-facing and practice-facing level for the community, it's simple. And it's the simple stuff that's often needed, and it works.